Is psychiatric treatment always an effective method of addressing mental health, or could it possibly inflict more harm than good? This question sets the stage for today's exploration of the anti-psychiatry movement, a fascinating historical and philosophical journey that challenges conventional wisdom and raises important ethical questions. The anti-psychiatry movement traces its roots back to the early 19th century, when concerns were first raised about the efficacy and ethics of psychiatric treatment. This was a time when the field of psychiatry was still in its infancy, and the treatment methods were often questionable at best. Fast forward to the mid-20th century, when the movement gained significant momentum. During this period, renowned psychiatrists such as Timothy Leary, R.D. Laing, Franco Basaglia, Theodore Litz, Silvano Arietti, and David Cooper began to question the validity and effectiveness of mainstream psychiatric practices. They expressed concern over the reliability of psychiatric diagnosis, the potential harm associated with psychiatric medications, and the failure of psychiatry to demonstrate any disease treatment mechanism for psychiatric medication effects. Simultaneously, philosophers and social theorists like Michel Foucault, Gilles Deleuze, Felix Guattari, and Irving Goffman joined the conversation, adding a broader socio-political perspective to the critique. They argued that the philosophical and ethical underpinnings of psychotherapy and psychoactive medication were shaped more by social and political concerns than by the autonomy and integrity of the individual mind. The anti-psychiatry movement also brought attention to the unequal power relationship between the doctor, therapist, and patient, asserting that psychiatry could be a coercive instrument of oppression. The movement highlighted the highly subjective nature of the diagnostic process and took a strong stand against involuntary commitment, a practice they saw as a violation of human rights and civil freedom. In recent years, the term anti-psychiatry has been disputed and sometimes used dismissively to refer to all critics of psychiatry. However, many within the movement agree that a specialized role of helper for people in emotional distress can be appropriate and emphasize the importance of individual choice in treatment decisions. To sum up, the anti-psychiatry movement is a complex, multifaceted critique of mainstream psychiatric practices. It questions the effectiveness of psychiatric treatment, highlights the potential harm associated with psychiatric medications, and raises ethical concerns about the power dynamics in therapeutic relationships and the violation of human rights in involuntary commitment. It encourages us all to think critically about the nature of mental health treatment and the societal structures that shape it.